The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. I am Tony Urbanek, and we are gathered here for the next episode of TMD Demystified. Today, I've had some quandaries about the topic I was going to choose. I almost decided to talk about the fourth part of the scandal of TMD. I don't know how many parts we're going to have, but I already know what the fourth part of the scandal is, and that is the great number of patients who see PCPs, nurse practitioners, walk-in clinics, ENTs for earaches that don't have earaches. They have TMD, but we're not going to talk about that today. We'll save that for another time, earaches and TMD. That is not the topic. Today, the title and topic is Hygienists, TMD's best defense. Hygienist, TMD's best defense. So let me explain. On a day-to-day basis, as we built our practice out, totally devoted to the non-surgical treatment of TMD, we, and I in particular, had to confront, how to get the word out that the solution, the real solution for decreasing, totally doing away with the symptoms of TMD, frequent and recurring, the big four for sure: headache, earache, jaw pain, and neck pain, plus tinnitus, subjective hearing loss, vertigo, shoulder and upper back pain, arm, hand, finger tingling and numbness, and various kinds of locking. We've discussed those in multiple episodes in multiple different directions, but those are the symptoms that are pandemic primarily among females, although I guess because of our marketing, we're seeing more and more males with the problem, more and more marketing awareness. I prefer the word awareness for sure, rather than marketing, because marketing leaves a bad taste in a lot of people's mouths, especially doctors, but it's not, should not have a bad taste in the mouth because of the word. It's awareness. But it is a big problem. It is pandemic. 45% of females have temporomandibular joint symptoms and continue to have temporomandibular joint symptoms, which are misdiagnosed. So, we worked out a proprietary protocol and program as how to get the word out to the physicians, the ENTs, the walk-in clinics, the nurse practitioners, the first line of defense in the medical community that sees most of these symptoms that I just reeled off more frequently than anybody else. That is a fact. And that marketing program is very, very effective. We get the results of that every day, not only in our own practice, but all the other doctors in our network of providers using the Urbanek device and protocol that use it in their practice. But where does the rubber really meet the road on this? Where can you be most effective if you really want to solve this problem for as many people as possible who are not aware that their daily symptoms of headache, earache, jaw pain, and neck pain, upper back pain, shoulder pain, tinnitus, subjective hearing loss, vertigo is all coming from the temporomandibular joint? And they have been told and treated by many doctors many different times for many, many years. The majority of people I see that 20, the average is 20 years, many people with 10 years, many people with 30 years of these symptoms going on that have been misdirected. How in the world can we really take a bite out of this problem and make as many people as aware as possible, because the patients are the ones who suffer. The doctors who misdiagnose it don't understand it. They are not the ones who suffer from these problems. They have a large part to play in solving the problem if they understand it and can put it on their differential diagnosis when they think about, well, why does this patient have frequent or recurring bad headaches? Why does this patient have frequent or recurring earaches? Why does this patient constantly complain of upper shoulder pain? Well, let's get an MRI of their neck and see if the cervical spine is screwed up some way. That's how it usually goes. But we've talked about educating the doctors before. But after giving this, as I always do, considerable thought as to how as many people, patients, can be aware of solving this for themselves, it's been obvious for some time to me that if the hygienists in the United States and throughout the world were well equipped to just recognize the symptoms of TMD, they are the most likely to be the first line of defense in educating and making patients aware that their frequent or recurring symptoms that I've reeled off twice now may be coming from their temporomandibular joint, when indeed their history shows that they're on drugs, that they've had neck surgery, that they've had 6 rounds of chiropractic over 3 years and continue to have the symptoms. Additionally, of course, inability to open your mouth widely, various types, kinds, and quantities of locking are obvious to a hygienist. On that point, I can't tell you, I mean, like, certainly at least weekly, almost daily, I get a patient in who's one of their remarks to me is, my dentist tells me I'm really hard to work on. I can't open, I have a small mouth. You must have, my dentist told me I have a small mouth. And I look at the patient, and the oral cavity is average size for the average patient. What they can't do is open up their mouth beyond 30 or 35 millimeters. 45 millimeters to 55 millimeters being normal interincisal distance on full opening. That is 55 millimeters on the high side, 45 millimeters on the low side for normal interincisal distance for a normal person. Males greater than females, but boy, I've seen some females that can get 60 millimeters. But a whole boatload of people come in here and say, my dentist told me I have a small mouth, and just has a hard time working on me, and it's been going on for 10 years, when actually they have bad TMD and they have all the symptoms that go with it, besides they can't open their mouth all the way. 10 years of headaches, 10 years of earaches, goes on. And it's been sitting right in front of the dentist and his dental staff for 10 or 20 years, like in his practice, unrecognized. See it all the time. This is not one-off. See it all the time. So if that's the case, if that's what's really going on out there on a daily basis, like, who would be the best category of provider to be the first line of defense about recognizing TMD? Well, my opinion is it's the hygienist. There are currently 150,000 hygienists, licensed hygienists in the United States of America. 98% of those hygienists are female. I just looked it up, just Googled it, just got that data right off of Google. So that is a lot of hygienists and all hygienists, very, 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 very few of those hygienists work in public health or don't do chairside hygiene. Almost all of them, as you know, they are integrated into the workaday hygiene, seeing the patient system. So if there are 150,000 hygienists out there, and almost all of them see patients daily, and just average it all out, maybe the practice isn't really busy, but just let's say the average hygienist who works pretty much full-time, meaning 4 days a week, sees 8 patients a day, That's 1,600 patients a year, multiplied by 150,000. That's 240 million patient contacts that hygienists have every year in the United States of America. 240 million patient contacts at a minimum. Now, we know that 45% of females and an unknown percentage of males, I won't quote males, but I can quote females, what percentage of females complain of temporomandibular joint symptoms of one kind or another, tightening up, starting here, mastocytory muscles, neck muscles, shoulder muscles, arm muscles, arm, hand, finger tingling and numbness associated with all these muscles getting tight gradually over time. So you have a picture there of 150,000 female, for the most part, almost exclusively, hygienists who are sitting in a dental office, in an operatory, next to a patient, cleaning their teeth, usually a 30-minute appointment, sometimes longer, I guess, and having the opportunity to, most of the time, do a one-sided conversation with the patient, but have the opportunity to read the history, medical history that's available to them, and talk to the patient about what may be their dental problems. They are there to help the dentist solve problems. Now, we all know hygienists cannot and should not diagnose. That is not what they do, but they can observe. And in the general rule, a hygienist, if he or she, primarily she, notes decay or periodontal problem, or a need for a dental implant or any other dental service that they offer in their practice, it is totally in their wheelhouse. Then at the end of the hygiene appointment, to bring it to the attention of the dentist. And most dentists actually check patients after hygiene. Most do. Some don't under certain circumstances. However, the general rule is that the hygienist then can bring to the attention of the dentist any suspected problems that need to be diagnosed and treated. And the hygienist is sitting there and examining the patient and watching that the patient that she's working on can't open more than 35 millimeters sometime, or can go through the very brief litany of saying, we see a lot of patients who have been misdiagnosed with TMJ problems that also have headaches, earaches, jaw pain, neck pain. Do you have frequent or recurring any of these symptoms? Doesn't take but a minute to open up the conversation. I can promise you that the average hygienist will find huge numbers of patients who are asked some very simple questions like, do you have these symptoms, or do you have a history of symptoms, that are going to respond, yes, and I currently have them. And then the patients will go on and usually discuss how many trips they've made to the ENT doctors or their PCP for their frequent or recurring headaches. All you need is the suspicion that there may be temporomandibular joint disease and inflammation within the joint, at which point it is perfectly within the realm of credibility and ability of the hygienist to just do the usual and simple examination to have the patient go from the open to the closed position with finger pressure in the joint. Boom. And if the joint hurts, the joint's inflamed. If the joint doesn't hurt, the joint is not inflamed. But I can absolutely promise you that, 50%, certainly a huge number of patients are going to go, ouch, when you do that. Oh my God, that hurt. At which the hygienist immediately knows the joint's inflamed and has made the diagnosis. If they have symptoms of TMD and the joints are inflamed, that is the definition of TMD, inflammation of the joint with designated symptoms, at which point at the end of the appointment, the hygienist can bring to the attention of the attending dentist that you need to see this patient because I believe she has temporomandibular joint problems, disorder. It's a very simple thing. And plenty of the only need and want is for the hygienist to be made aware that they can do that they should do that on a routine basis, and it will bring to the attention, direct attention of the patients who need it the most. If the patient has the problem and doesn't want to learn about it, or once diagnosed be treated, well, that's up to the patient, of course. But the fact that it is being missed on a huge volume of patients routinely that are sitting in a chair, dental chair, with a dental technician person who is perfectly capable of diagnosing it, even though it can't technically be made, and passing it on to the dentist who can technically diagnose the problem, is a big failure, a huge failure. How long does it take to educate a hygienist to know the symptoms, ask the proper question on a history, do a very brief and simple examination of the patient, and then find out whether that practice, that doctor, can actually help that patient with the problem, which they can, by eliminating the inflammation. And you can eliminate the inflammation by unloading the joint. And you can unload the joint by using the organic device and protocol. It's that simple. So it's all about increasing awareness for the patient for sure, but the first line of defense, hygienists, TMD's best defense. And I claim that. And so we're doing an episode here on a podcast on Dental Town that features access to thousands, if not hundreds of thousands of dentists and hygienists to talk on all kinds of subjects. And this is one subject that, you don't have to learn in hygiene school. I mean, you can learn it right off. In fact, you just did. If you review those symptoms and can memorize those symptoms and you know what to look for, and you know how to do that simple self-exam or examination of another person, because you can do the exam yourself or you can do it on another, all you have to need to know if you're a hygienist. And again, I can promise you that 45% of hygienists, if 45% of females have these symptoms, I can promise you that 45% of hygienists themselves have one or more of the symptoms of TMD. It is that common. It is that common. And as we increase in our daily lives, as we all experience life over the decades, we all know that life is getting more complicated. Things are moving much faster. Stress of different varieties is increasing, I consider, logarithmically, not arithmetically. In my career, lengthy career, 45 years as an oral maxillofacial surgeon, I've watched my colleagues, I've watched myself, I've watched others in my family and my friends and the community and in the United States. It's frenetic. The frenetic motion and the stress that are on people more than ever before. And of course, the only thing we know about the causes of bruxism is stress. We don't know anything else. There's a lot of theories about bruxism. I've read up on it. Anybody who is honest about it or done a honest paper on it will give you theories, but will be direct in their statement that we really don't understand the mechanism of bruxism. It is within the central nervous system. It starts out in the brain stem. It is definitely associated with stress. The more stress, the more bruxism, and that's all we can say for sure, because we see it. That has been studied. More stress, more bruxism. And bruxism is one of the three primary activities or situations, called situations, that is associated with causing inflammation in the joint. So bruxism is actually the most frequent, causing inflammation in the joint. The constant motion, the constant force will eventually break down the structures, specifically the meniscus, which causes inflammation. Inflammation can also be generated by functional malocclusion and also by acute trauma. So those are the three situations that damage the joint, increase inflammation, but bruxism being the primary one, and bruxism is definitely related to stress, and stress is increasing in our society significantly, logarithmically almost, here over the past few years. So hygienists, it's about getting the word out again. It's about how do you make a hygienist aware that they can play an integral part, extremely important part, and help their patients, a large number of patients, not the occasional female or male that's sitting in their chair. And then the study needs to be done. Well, how many patients sitting in a hygiene chair actually have symptoms associated with TMD? Again, that's an easy study. I have a long list of studies that should be done. I hope eventually to get to some of them. I can't do them all, but if anyone who'd like to do that study, give me a call, because we'll set up the mechanism so that you can do that study in your practice. How many patients sitting in a hygiene chair actually have TMD? Easy study to do, and document and publish. It'd be a good publish. You want to get your name in published. Easy. That'd be a good study. So as an assistant to what I just said, I'm going to include the video that we have, very short videos, 90 seconds, of how to do the self-examination or the patient examination, same exam. Have the patient open widely, press firmly in the glenoid fossa with your fingers, and have them bite together on their back teeth rapidly, as fast as they can. And if there's inflammation in the joint, the patient will go, ouch. And if there's not inflammation in the joint, the patient will not respond with pain. And then if you actually have that in conjunction with a bunch of those other symptoms, you don't have to have them all. The four big ones are the first four I reeled off: frequent or recurring headache, earache, jaw pain of various kinds, including it feels like my teeth hurt, and neck pain. Neck pain being the second most common symptom of the four. Headache number one, neck ache number two in frequency in TMD. And if the hygienist could be educated and made aware of what an opportunity they have to help their patients, their fellow man, and their practice, I think that they would jump at the chance to do that. So, and then when it gets down to passing it off to the dentist can easily sit down with the patient and explain, as I do on a routine basis, and my associate in our practice explain on a routine basis, how it works, why inflammation within the joint, temporomandibular joint, can cause anatomically, physiologically, well known, well put together, just connect the dots, doctor, as to how that comes about, where it can cause various pains that the patient describes as frequent or recurring headaches, earaches, jaw pain, neck pain, tinnitus, subjective hearing loss, vertigo, upper back and shoulder pain, arm, hand, finger tingling, and numbness and locking. If anyone out there would like to test this ability out in their practice to get their hygienist associated with doing this, you don't need to ask me. You can just do it. And we'll attach, Naomi will attach the 90-second instructional video, which you can use at your liberty, and include it in your patient consultation or information, or specifically educating your hygienist. It's more than a good idea. I'm searching for a way to actually get it in the mainstream. Once it's in the mainstream and accepted, then it would go like wildfire, because it's such a great opportunity to help your patients and all. And if you want goodwill, if you want to generate goodwill, I can tell you, doing oral maxillofacial surgery for 40 years, and the goodwill that I generate by getting someone out of temporomandibular joint symptoms that is non-surgical far outweighs the goodwill that was ever generated by me taking out their wisdom teeth, doing their cleft palate, doing orthognathic surgery, or fixing their crunched face in a motor vehicle accident, and all the other surgical procedures that I did over 45 years as a maxillofacial surgeon. When you get somebody out of pain that they've had for 5, 10, 20, 30, and some people 50 years, the goodwill that it generates is tremendous, meaning goodwill for you and your practice, which drives other patients into your practice because it generates so much goodwill. So it all flows downstream. You're not swimming upstream with this at all. And the hygienists are the best defense on TMD. So for today, I've made my point. If there is anyone who has an interest in addressing this with their hygienist, please give me a call or a text. You can reach me always at Tony@tmjservices.net. Our Director of Education and Marketing, you can reach her, Naomi, at tmjservices.net. If you are interested in joining our network of doctors, growing network of doctors throughout the United States, which is now making good steps as increasing our footprint throughout the United States, and doctors who use the Urbanic device and protocols successfully, independently studied, university studied independently, proving that our success rate is in the 90%, and acceptance rate and within the patient population is that high. So give us a text or email or a call even, and we'll be happy to talk with you. So for today, I look forward to the next time I can speak with you. I'm not sure what topic I'm going to choose for next time. We'll see what I think is most important for the time. But for today, I want to emphasize that hygienists are TMD's best defense. I am Tony Urbanic, and this is TMD Demystified.
Steps to a self-exam. Step number 1. Place your fingers of both hands in front of your ears where the TMJ is located. You should be able to feel a depression in front of the ear as you open your mouth widely. Step number 2. Open your mouth as wide as possible. You should be able to feel the depression when you open your mouth. Press firmly into the depression, equally on both sides. Step number 3. Close your mouth rapidly. If you feel pain on one or both sides, it is highly likely you have TMD, temporomandibular joint disorder.